నా పేరు రజిత. 2015లో ఫస్ట్ ఆపరేషన్ అయింది. తర్వాత సెకండ్ ఆపరేషన్ 2021లో అయింది. మ్యారేజ్ చేసినాక ప్రెగ్నెన్సీ వచ్చింది. సార్ ఇంజెక్షన్స్ రాస్తే ఇంజెక్షన్ ఇప్పించుకున్నాక తర్వాత మళ్ళీ వాళ్ళు మోసుకుపోయింది అనేసి మళ్ళీ ఆపరేషన్ చేయాలి అనేసి అన్నారు. మళ్ళీ సెకండ్ ఆపరేషన్ 2021లో అయ్యింది. ఆపరేషన్కి అందరూ మంచిగా చేసిర్రు. అందరూ నేను బతకని అనుకోరు, కానీ నేను బేబీతో మంచిగానే వచ్చిన. వాళ్ళు మూసుకుపోయిన అనేసి మరో వాళ్ళు వేసిర్రు, కొత్త వాళ్ళు వేసిర్రు. ప్రెగ్నెన్సీతోనే ఉన్నాను. బేబీ కూడా బాగానే ఉంది, నాతోని బాగున్నా నేను కూడా ఇప్పుడు.
I'm Dr. Suresh, head of the department emergency medicine at Yashoda Hospitals, Somajiguda. Regarding Rajita, she is a 21-year-old female patient brought to emergency department in a condition of shock. So after initial evaluation, we did the screening 2D echo and have checked old record, and it was noted that she had a prosthetic valve repair way back in 2015 now, and she presented with cardiogenic shock. So initially she was in respiratory distress and failure, so we resuscitated her, started on non-invasive ventilation support, and then we started on inotropes, and then we recognized her condition as a cardiogenic shock, which is very much required, and the cause for that is due to the prosthetic valve obstruction which she operated way before. So in this condition we involved the senior multidisciplinary team at Yashoda Hospitals, Somajiguda. There Pankaj Jariwala, Dr. Pankaj Jariwala, senior most interventional cardiologist, and Dr. Satya, Sridhar sir, he's a senior cardiothoracic surgeon, as well as Dr. Sujata ma'am, senior gynecologist. So we worked as a multidisciplinary team, and the case has been handed over to cardiology department after the thrombolysis in emergency department. Though it is a bit risky to give to administer thrombolysis in this condition, as Rajita was pregnant. But we took a chance and we thrombolyzed her and then shifted to critical care unit thereafter. Yeah. And I give hand over to Dr. Pankaj Jariwala, sir, cardiologist. Yeah.
Hello, my name is Dr. Pankaj Jariwala. I am interventional cardiologist at Yashoda Hospitals, Somajiguda. Recently, we had a young girl who presented to us with prosthetic valve thrombosis, and this patient actually underwent mitral valve replacement surgery in 2015, which was done under my guidance. But later on, she had one episode of thrombosis, that is a clotting of the mitral valve, and those days we thrombolized her. This time it was very difficult situation for us because she is 14 weeks of pregnancy now, and again she developed the thrombosis or clotting of the valve, of the same valve. But the situation clinically was very serious because her blood pressure was almost less than 70 millimeter of mercury, and our emergency team doctors stabilized her, and we gave thrombolytic therapy, that is one of the very strong medicine to dissolve the clot. And sometimes in pregnancy it becomes very dicey situation whether to administer such a strong blood thinning agent to the patient or not, because the mother and the fetus both are at risk of giving such kind of medicines. But despite of giving that medicine, we could stabilize her barely, and later on when in the ICCU her blood pressure started dropping and she started having very severe breathlessness. So because of that, we took the combined decision along with our cardiothoracic surgeon Dr. Satya, Sridhar, and gynecologist Dr. Sujata madam to continue pregnancy and then to subject her for a repeat mitral valve replacement, what we call it as a redo mitral valve replacement surgery, which is highly risky procedure, because doing a second time procedure in a pregnant female, it was really challenging to our entire team, and successfully we operated her, and she has completed now a first follow-up after 10 days. She came to our outpatient department walking without any problem, and the good thing is that her pregnancy is still continuing, and hopefully she will deliver after the 6 months with her baby. So thank you very much.
Yeah, I'm Dr. Satya Sridhar, senior cardiothoracic surgeon at Yashoda Hospitals, Somajiguda. This lady, 21-year-old, she underwent a mitral valve replacement in 2014. She has presented to us with acute dyspnea and SOB, and she was treated by the cardiologist, and we have treated her with by giving a thrombolysis. So valve was stuck with mitral valve thrombus. Then we did emergency surgery for her, redo emergency surgery. Then we have replaced her mitral valve with a metallic valve, and incidentally she was pregnant 14 weeks, so we had to preserve the child as well. So we could preserve the child even after cardiopulmonary bypass. So the child and the mother is safe, and she is on regular follow-up with us, and she has anticoagulation has been adjusted, so we are putting her on Clexane BD, and with that she is maintaining an APTT of 300, so that is being maintained. She is on regular follow-up, and her pregnancy is being continued, and we are hoping to have a mother and child safe.